Welcome to Conversations with Perinatal Psychology, talking about maternal mental health, because your mental health matters for you and your kids. I'm Dr. Blaithin O Dea, psychologist with the Maternity Mental Health Service, and today we're talking about the importance of information for healthcare professionals, so information about maternal mental health and how to get help. And today I'm joined by someone who is leading the charge in ensuring healthcare professionals, particularly midwives and obstetricians, have useful and up-to-date information about perinatal mental health and support available for women and their families. So I'll ask Helen to introduce herself.
Hello there, I'm Helen Bloomfield. I'm the lead midwife for mental health at Hampshire Hospitals.
Thanks, Helen. It's really nice to be here today having this chat in person at the Andover Birth Centre, which feels like a real treat. Okay. So thinking about this really big topic, I guess I wanted to ask you to tell us a bit about your role as a mental health midwife. It might be helpful for people to understand what that means, what that is.
So mental health midwives are, they can be slightly different across different trusts. So I think every trust does it slightly differently. So what I'll explain for Hampshire may be different in other areas and other hospitals. But our role really is to make sure that women and families are accessing and receiving appropriate help for their mental health through the perinatal period, so in the time in which midwives are involved. So my job really is a mix of things, which I love, obviously. It involves a lot of supporting midwives and teaching and training midwives and other maternity professionals to make sure that they've got an understanding of maternal and perinatal mental health. And so we support the midwives to support women and families, ensuring that they are getting appropriate information and access to healthcare.
Brilliant. It's such an important role, I guess, at this vulnerable time for women and for families. And it's great to know that there's somebody there, that point of support and information for these midwives and doctors, so that if they're wondering how to support someone or what information to give them, that they've got you to come to.
Yeah, I mean, in an ideal world, we would all have, we'd have that information at our fingertips as midwives. But midwives, obviously, there's a huge role in just the maternity aspect. So we can't expect them to know everything about everything. So that's part of what we as mental health midwives are there for, to be that resource and that specialist with the information at hand. And there's also something about midwives who are expected to be, the expert at normal. That's what midwives do. They deal with normal birth and normality, but with the understanding that they need to be able to recognise when things go out of normal and then who to refer on to. So that's, we're supporting midwives to understand when things are going out of normal with someone's mental health and what they then need to do about it.
And thinking about, as you say, the vast role of midwives and all the things they have to know about. If I was a new midwife in post and, was undergoing my training and coming to you for advice about the kinds of things I should be asking mums about in relation to their mental health and their mental well-being, what kinds of things would you be advising midwives to ask about?
I think, my first comment always to our midwives, and they would probably tell you the same, is to be kind and to try and imagine what it's like to be in that woman or that person's head, really, is the first point. But yeah, I think, the first question that anybody will ask is, how are you doing? Whether that's in the antenatal period when they come in for an antenatal appointment, or whether it's for, when they're in the middle of labour or in the postnatal period. How are you doing is a really good starter question. And it can be really general, so that relates to physical as well as mental health. And I talk a lot about the whole thing around ask twice. So that idea of, and I got it from Roman Kemp when he was talking about young men committing suicide, actually, and that his group of friends do this. And it's something I'd done before, but he really highlighted the fact that you ask once and someone will say they're fine, and then you ask again and they might give you a real answer to your question. So it's that thing about asking the question and leaving space for women to answer that question honestly. But specifically, I would want midwives to be asking about the woman, the family's mood. So we're asking about mum as well, but also the wider family. So dad or other mum or birthing partner, the parents in that family, as well as it's not just about mums really. So we're asking about how they're feeling, about sleep. I mean, sleep is a really important one when it comes to mood, isn't it? We know that, it's the reason they use sleep deprivation as torture, is because it leaves you really, otherworldly and not particularly feeling good. So asking about how they're feeling, asking about how they're sleeping, which obviously, if you've just had a baby or you're heavily pregnant, is going to be impacted. And then that can lead to a conversation further about how that has impacted their mood and their general well-being. If mum, if they've had a baby, it's talking about how they're feeding that baby and how that's going, because that also is has a huge impact, doesn't it? And then if they're feeling anything different, if things have changed or if anything feels a bit off. In Hampshire, we're really lucky that we've piloted this a Perinatal Pathways screening tool, and it basically asks a number of those questions in a really simple format on a website, and it then directs both the family and the midwife to where they can be accessing their help for their mental health, whether that be via their GP or discussions with talking therapies, I talk, as we have here, or whether it's something bigger and needing a referral to a more specific mental health service. So that's a really useful tool.
Thanks, Helen. And, coming back to this idea of having so many things to consider as a midwife and putting myself in those shoes as a new midwife, I think the things I'd really take away from what you're saying, firstly, would be ask twice. I love that. It's so powerful, isn't it? I think we feel really seen when somebody acknowledges that, oh, I'm fine, that there's got to be more to say about how you're doing, whether you're pregnant or you've just given birth. There's got to be more to say there, whether it's positive or whether it's more difficult stuff. I think I would absolutely take away this idea of the Pathways tool, which of course we're aware of in Hampshire as something we can use, but that there's a tool there that allows us to assess what might be the right pathway for support with somebody who's struggling.
And that tool it's about opening conversations. It's not meant to do it for you, but I think for an inexperienced midwife or somebody who's a bit nervous having those conversations, it opens the door to it, because it asks those leading first questions, and then that conversation can be developed.
Something about sleep, as you say, sleep is a real clue to how challenging things are feeling, how well you're able to actually power down and get rest when you get the opportunity, whether there's anxiety getting in the way of things, whether you're feeling a bit low and needing to sleep more and more and more. So yeah, I think that's a really good guide or crash course, if you like, for what a midwife might be advised to be asking about.
And I think it's also, we're there to signpost. As midwives, we are not mental health professionals. We're there to, like I say, see when something is moving out of normal and refer it on.
Absolutely. So thinking about specifically signposting and making sure women get the support that they need, what might be the advice you would be giving about where to signpost a mum or a family who might be struggling?
So I think, the first one we talk about is speaking to their GP. That's always first point of contact, but we're also aware that, again, GPs are general practitioners. They're expected to know about everything, and so they probably have a bite-sized understanding of everything. So to be more specific, I would say that we often will refer women onto talking therapies, so their local IAPT service, so ours is called iTalk, who do various forms of counselling and such, so that's a really useful one, and I would say most midwives know that, that's their first sort of point. Here in Hampshire we have something called Hampshire Lanterns, which is a peer led group, and their tagline, I think, is no mother should ever feel the need, should ever feel alone. And it is about peer support and other families who've gone through similar, so it can be a really helpful resource and a place to link in with. We talk also a lot about pandas, who are post and antenatal depression group, but that's where their name came from, but I believe that they cover and support all sorts of mental health. And then the other, which is around here, we have some really useful physical places, is Mind, and they work with all sorts of people with mental health issues, but their website has a fantastic piece on perinatal mental health, and is really useful. For, I think, most people in Hampshire, most of the services now in Hampshire, our maternity service has gone to something called Badgernet, which is a computerised version of notes, and within that we can send out information to women via their Badger notes, which they get into their phone. So they get, and we've added all sorts of different resources around mental health into that. So it means that the midwives don't necessarily need to know what that resource is, but to know that because it's been chosen by myself with other recommendations from other people, we believe it to be good. And they've things like anxiety and OCD and psychosis, so that midwives can just pull some of those out and just send them out to the women via that resource as well. So that really helps in sharing that information and supports midwives to not need to be the expert, but to know where to access that information.
Yeah, and I think that last point is so important, isn't it? That if you can have had an open conversation with someone, they're struggling. As a health professional, you don't need to be the one to sort that or fix that, but that you can access the right information to give the family the numbers they need, the tools they need to go and access that help themselves. And I love that our systems, our technology is supporting that finally.
Yeah.
Badgernet is doing that. That's really
It's not the easiest for midwives, but there's some positives.
And I guess before we wrap up, Helen, I'm aware we're just scratching the surface of the broadness and busyness of your role. And I suppose a lot of the work that you do is around supporting families after the birth, particularly if there's been some challenges or some difficulties. Then is there any sort of brief information you could give for other health professionals about that part of the role, and I guess what exists for families if their birth experience has been difficult?
Yeah. I mean, it's all around feedback, isn't it? We ask families for their feedback and what we've done, and we act on those. We also have to act on complaints and such that bring up specifics around their care, maybe. But in terms more of their mental health, I would say that birth reflection services, of which I think pretty much every trust will have a form of, means that there's a dedicated space for women to come back to and explain the impact of things that happened during their birth, and also get a better understanding of maybe why things were done. But that gives us the ability to bring that information back into the service, so to bring it back to individual midwives or in a more generalised way back into our training. Like you say, there's loads that needs to happen, and there's across the world, aside from just maternity. But I think if we can begin to hear what people are saying and what they are telling us about their experience, that helps us to bring that back into the service as a whole. And I think the one thing that I often take back to midwives is, it doesn't matter what you did or said. This is this woman's experience. And I think that's really important for us to, step away from what we did as professionals and be mindful of how that has been experienced or taken or understood.
Something really powerful there, isn't there, about listening to women and families, and being able to advise them that we're here and ready to listen, we want your feedback, and that we have these avenues to support you if you've had a difficult birth experience. And we could, and maybe we one day will do another episode or installment all about birth trauma and difficult experiences of birth and what support is out there for that. Thank you, Helen, so much for taking the time to explain a bit about that, and I've no doubt that lots of professionals will find that really helpful. Also, as ever, important to add that if you have been affected at all by what we've been talking about today, you can access support through your GP, health visitor, midwife, or call 111, who have mental health experts on hand. You can also go to the Southern Health website, which has a help in crisis link and a list of local support contacts. Thanks for listening to Conversations with Perinatal Psychology, talking about maternal mental health, because your mental health matters for you and your kids. Take care.